Hey everyone, happy Thursday. I feel like I haven't seen you all in a long time. I hope you're doing exceptionally well. Dr. James Dever is in Arizona, and he and I were just having a conversation about my health, which was so gracious of him. And I was like, okay, we got to stop and we have to go live because we have to chat with all of you. So, James, welcome. Thanks for joining me.
Thanks for having me. Appreciate it.
You're welcome. So let's just jump in. So our conversation began with this little thing called soybean oil.
Yep.
And James asked me, what is your knowledge about it? And in all honesty, I think nutrition is fascinating. It's just not something that grabs my attention usually. But then James went off. So James, let's start this discussion about soybean oil. And what have you experienced in your practice when individuals use it, don't know about it, and then what happens when they eliminate it?
Yeah. So it affects females a lot more than it affects males. I think it affects males too, but just in different ways. Most people, they'll come in, they'll say, hey, I've got left knee pain, or I've got hip pain, or I've got shoulder pain, like a frozen shoulder or something like that. And when you dig down through the layers, you start to see that the estrogen levels are high. And for a lot of people, it'll create lymph blockage right here in their armpit. And if you feel around, sometimes you'll be able to feel those hard bumps. And those hard bumps are basically a block. Your body's trying to use the lymph system as a reservoir for your blood, and it needs things to be free flowing. And if estrogen is too high, which your brain sees the soybean oil as estrogen, it'll start to block those tubes. And when those tubes get blocked, our flow of hormones, our flow of blood, the function of our body starts to stop. And so it's not necessarily a certain number, it's the function of systems. So sometimes we'll measure, somebody might say, well, but my estrogen levels are normal. It's like, oh, that's great. But your body, the way it's using them, it can't get rid of them. It can't process them because the blood system's being blocked because of its reaction to the soybean oil, which it sees it as too much estrogen. So everything from skin complexion, from acne to, you'll have patients that'll say, hey, I don't eat more than I should. I don't overeat, but I'm still 40, 50 pounds overweight. And I'll have them get off this stuff. Their brain will clear up. Their skin will clear up. They'll start dropping pounds at a healthy weight. None of this like 10, 12 pounds a month nonsense. They'll just nice and balanced, a pound a week, maybe a little bit more. And 4 or 5 months later, their bodies are feeling better. They're just working like they're designed to work. And so I get pretty excited when I see a patient make the commitment to, you know what, I'm not going to eat that stuff, because they come back and tell me they're almost upset. They say, hey, I had no idea it was affecting me like that. And then they get rid of it and they just start, their whole body shifts the way they feel. And then if they ever eat a little bit, they know it without even looking at the package, because now they're really aware of its impact and they can feel it almost immediately. And my wife, she came up to me. I've been telling her this for over a year. Hey, you got to get rid of this stuff. And she came up to me probably 2 or 3 months ago, and she said, I've finally committed 100%. I'm finally in. Exactly, right.
Right.
And she says, you know what's crazy is I'm losing my pound a week. I don't have headaches on my period anymore. Her appetites are accurate. She's satisfied with the meal, knows when she's hungry, knows when, when she's full. The signals are so much clearer. And I've heard that over and over and over with patients in my office. It's just unbelievable, its impact, especially on the female population. It is just it's too important. It's too impactful to not get rid of it.
So I want to speed bump for just a second for everyone. Listen, it's not like, oh, Dr. Barbara, Dr. James, I'm not taking like soybean oil and putting it in my food. I'm not doing that. I'm not eating soybeans. And that's not necessarily what we're talking about. Like, that's often that you're not. However, it's a common ingredient in a lot of food.
Yeah.
And you may not even be knowing how much soybean oil that you're eating. So,
Right.
number one, be a label reader. And if it says soybean oil, get rid of it. Let's talk for a second about it. Really interesting what you just said there on she feels satiated when she eats, her signals are accurate, all of that. And you and I, before we went live, had kind of started talking about what happens in the gut with fungus and improper signals. Can we go there? And then from there, let's also talk about mental health and depression as it relates to this phenomenon.
Yeah. So there's kind of a system. So we're built like a tube. We don't realize it a lot of times, but from our mouth to where everything comes out, we're one long tube. And that tube is there to help us absorb our nutrition, bless you, and help us absorb our nutrition, our fluids, and everything we need. And in nature, there's a bacterial fungal balance. And when you look on the outside of a grape or a cabbage, you'll see that white film. And what that white film is actually bacteria and yeast that need to be there for that plant to be healthy. And in good soil, there's that same ratio of the bacteria and fungus that we also need in our bodies for our brain to work right, for our bodies to work right. We need those little critters. And those fungus and bacteria, they also secrete different chemicals after they've eaten, and they secrete those. And we need those secretions as well, but we just don't need them in excess amounts. And so there's a whole kind of system here. Let me kind of draw this out real quick. Here we go. Perfect. So it comes down into our stomach here. Our food does. There we go. There we go. Okay. And inside that stomach, we need stomach acid. And just like if we're going to marinate chicken or beef or anything, we need an acid to start breaking down our proteins. If we don't have acid, we can't break down a protein. It'd be like marinating your chicken in water. That chicken's going to be tough, and it's not going to be that same soft, juicy tenderness. And our systems are no different. The whole purpose of the quick dip in this stomach acid when it comes down our throat is to break down the proteins and make them usable. If they don't get broken down, let's say because our nervous system is messed up and our stomach's not producing acid, or we're taking a stomach acid blocker, then the food will stay in here longer. And then the body isn't able to break down.
Let's stop there for a second.
Yep.
Sternum and C2. Talk about that for a second.
Yeah. So one of the main things I find in my practice, if somebody's stomach acid is low, they'll complain of heartburn. And that heartburn, what happens is the food stays here and the acid will come to the top, goes in the throat. It'll produce a hiatal hernia. And then to correct it, their sternum, which sits right above that stomach, right there in the chest, their sternum will shift to the right side. And so what we'll do is we'll adjust that sternum from the right to left. It's about in the middle. And then also we'll see a big knot right here at the C2 vertebra, right on their neck, and it'll be real tight. And they usually know about that one. And the other thing you'll see is when you get that C2 there, they'll complain of hip pain. Their right hip will always hurt with this situation or be sore. And maybe not all the time, but they'll have certain situations like, when I sit in my chair this way, my right hip hurts. Stomach acid, their C2 is out, their stomach acid is low. And when their stomach acid is low, they complain of heartburn. They get on a Prilosec or a stomach acid blocker. And then their problems really start going there because now they had almost no acid and now they have none. And so it starts to really have impacts down in the intestines. So,
which is so funny because we're told your stomach acid's too high.
Right.
Like you have too much when really it's the opposite. All right, go ahead.
Right. So if the proteins don't get processed because there's not enough acid to break them down, the stomach isn't that big. eventually has to let the food go on. So as it comes on into the small intestine, the food will sit here and it'll just rot because the proteins aren't broken down. And then when it starts rotting, it starts to irritate the gut lining. And that lining is designed to be part of our immune system. They say the immune system is 97% of it's in the gut. And I think it's that lining. They don't have anything in the anatomy book that says, here's your immune system. But that lining is our defense to the outside world. And so as the food sits in that intestine, it's going to rot, and because it's not broken down. And then we start getting leaky gut. And then with that, we start having the fungus and the bacteria that should be okay, sorry. I can't write.
Move it.
So
yeah, perfect. There you go, right there.
So this is an F right here. The fungus should be roughly 25%. This bacteria 1 group, they use oxygen. They need about 50%. And bacteria 2, they should be about 25% of the population. What happens when our food rots in the small intestine over here, the fungus take over. The fungus go up to maybe 60, 70, 80%. When we get up there, the secretions of this fungus, they start to attack the brain. And a person will have brain fog, their sleep, they'll wake up tired as if they never even went to bed. And their guts won't work right, and they'll still have all sorts of food allergies. I eat this, I don't feel well. I eat that, I don't feel well. My joints are achy, things. And then their brain is so unclear, their memory, they'll be like, I can't remember a thing I just did. I just did it 2 minutes ago, but I don't remember what I did, right? The whole body starts to struggle with this. But what we've got to do is we've got to get back. So this is what causes that depression, is when these bacterial and fungal get out of whack. But when it comes back to the source, we've got to make sure we have enough stomach acid. So we got to make sure our nervous systems are adjusted properly. And we also got to learn to manage our stress, which is what Dr. Eaton does, helps us process what it is our thoughts are, our feelings are, and to really see them for what they really are.
So
and then with that,
let me pause you right there for just a second.
Yeah.
So walk us, like, slow us down on the fungus overgrowth and what happens in brain with not being
with not being what?
Like, finish that loop.
Okay.
With, like, your wife said, hey, the funny thing is like, now I'm satiated. The signals are right, because that's kind of what happens with depression too, right?
Right.
That the fungus are giving signals that aren't really true.
Right.
Go there.
Yeah. So where we get changes in the brain from the fungus is the fungus, they eat and drink just like we do. And so all of our antibiotics are made by fungus. And so fungus, they actually secrete antibacterial. So penicillin and some of these, they're made from fungus. Antifungals are made from bacteria. That's the stuff they stick in our tortillas and our cheese to keep it from molding. And so when this ratio gets out of whack, so we have all this fungal secretion in the gut. When that secretes, our bodies absorb it. And so those fungal secretions, now they're in our brain. And what they actually do is those neurological signals, they misfire. So the neurological signal comes down the pathway, and it's that fungal secretion sticks itself right in between it. Because our brain, the connections aren't actually connected. The signal comes down and then it has to arc over to the other side. And so the fungal secretion will stick itself right in the middle. And then that neurological connection can no longer be completed, and it short circuits. And that short circuit is where the depression, the loss of memory, the fatigue, the brain fog, all of this starts to happen because our brain signals are trying to fire, but they're not making it. So they have to reroute. And so when our stomach works right, when our hormones work right, those signals start to happen really efficiently. And when they happen efficiently, your brain knows, am I hungry? Am I thirsty? Am I full? It starts to be able to have those neurological circuits know what the true facts are. But fungus doesn't want you to know that. And so that's why they secrete it so heavily, because they want to keep themselves alive. And to keep themselves alive, they need sugar. And so a person's going to crave high fructose corn syrup. They're going to crave that refined sugar that takes no work to get to. Anytime you see sugar in nature, God put fiber with it. Always. Always has the fiber with it. A grain, a fruit, you name it. If there's sugar in nature, he put fiber with it. Even the sugar cane is full of fiber. Always, always, always we have fiber going with that sugar. And so that fiber disrupts the fungus. And it keeps those cravings from happening. So the more fiber we eat, the more, cabbage and vegetables and all this stuff, the majority of that work is to back off the sugar spikes so our bodies function properly. So the fungus are just trying to keep themselves alive. And as we reverse that process, they start to die off, and then our symptoms start to change.
I think that's so interesting. And then the other thing we quickly spoke about, do you have practice members that are there?
Soon, yeah.
Okay. So let's talk for just a second about back to the gut and acid and meat, right?
Yep.
So then, Dr. Dever, I just won't eat meat. Does that solve everything?
No, because protein's in everything. 100%. Everything has protein. It's different densities, but everything has protein. So gluten is a protein.
Meat, right? It's not the meat that's sitting in the gut. It's the protein that's sitting in the gut that can't be broken down. So for those of you who are choosing, oh, I don't feel good after I eat meat, so I just won't eat it. It may not be the meat. It more likely is the protein. Is that accurate?
Yeah, it's just a general protein because you get tons of protein in cheese, tons of protein in grains, tons of protein in vegetables. And so it's not, I'll just cut this food out and I'm good. A lot of people, they'll cut out gluten and they still feel terrible. Just a protein that didn't get broken down.
Interesting.
Yeah.
And what's the connection with pH and cancer?
So pH, every cell in the body has the pH, and just like our pool, you got to measure that pH really closely. And if that pH drops, that pool is going to go green. And just like you wouldn't want to swim in that, if the pH of your cell drops, you don't want to live in that. And so with cancer, the cell needs the pH to be high. It needs to be at least above 6.8. And if the cell tries to regenerate itself, but it's too acidic, the cell basically doesn't regenerate itself properly. And then then it turns into a cancer cell. That can be a blood cell. A lot of times people are like, okay, leukemia, things like that. You can have any cell of the body. And so, and then our stomach acid is just one important role in helping us to maintain proper stomach acid, cell pH. And pH is a little bit confusing because we have a blood pH, and the blood pH is different than the cells of the blood and the cells of the body. And the body will always keep the blood pH correct. It'll take all the calcium out of your bones to keep it right. And you'll see people with cancer take an x-ray and their bones are thin as can be because their body's been using the calcium to rise their blood pH. And so when we get back to the cell pH, two of the biggest things that change the cell pH is the emotions and the upper neck adjustment. If that upper neck is not properly adjusted, the nervous system, the brain basically gets disconnected from the cells below it. And then the cells have no idea what to do. And that the C1 vertebra is attached to the dura. And so that's the only vertebra that's attached to that bag that goes around our brain and spinal cord. And if that vertebra is moved even 2 millimeters, it'll change all the brain signals, and the cell just gets totally confused and really struggles to maintain a proper pH. And if our pH drops, we're going to have a bunch of symptoms. And then if it goes real low, then you'll have cancer. And it's totally reversible, totally changeable, but it's dynamic. The body is never, hey, it's one thing. We've got to take care of our physical, chemical, and emotional stress. You can't just ignore the emotions and just take care of your food. You can't just ignore your adjustment on the physical side and take care of your diet and your emotions. It's all three. The body's it's a dynamic piece. And so you have to make sure you're balanced and taking care of all the pieces.
It's an amazing machine.
It's amazing.
Amazing machine. And I still don't think we know it all about it.
No.
I think there's more and more and more to be discovered, for sure.
I feel like the more I learn, the more I see, the more I realize I don't know. And you just realize how simple, but then also complex at the same time.
And I want to encourage all of you, and I say this with all the love in my heart. The upper cervical spine is unlike any other part of the spine, between occiput C1 and C2. And it requires a chiropractic specialist who's been specifically trained to locate, analyze, and adjust that critical area. So I 100% know that all adjustments are not the same. They are not the same. And Dr. James and several others in the boot camp and throughout the country, throughout the world, have specifically been trained on the care of the upper cervical spine. And in my own experience, my son, I was adjusted before I ever got pregnant. I've been adjusted since I was a year and a half. And Samson was born with upper cervical subluxation, severe. Getting adjusted activator, he was getting adjusted basic, like he was getting adjusted. But C1 had never been properly addressed. So from the time he was born until he was 6 months old, it was ear infection after ear infection after ear infection, even though I did all of the things right. And I finally took him to an upper cervical doctor in Cape Girardeau, Dr. Rob Kesslinger, who scoped him and was like, his atlas needs to be adjusted. And I'm like, but he's been getting adjusted. But the difference is this: atlas adjusts in the X, the Y, and the Z. Yep. Right? Atlas can torque. They had never been addressed that way. He got adjusted, new test that day, and obviously continued to be adjusted. Has never had an ear infection since.
Yeah. Yeah.
Because of the torque in the upper cervical spine. So I'm asking chiropractors, be trained in the care of the upper cervical spine. And for practice members, insist that your chiropractor is a specialist in the care of the upper cervical spine. Your world will change.
Yep. Mine did. I took a picture of my neck because I felt like something wasn't right about a month and a half ago. And for the first time, I saw exactly what was wrong. And I think I've had that since I was probably 7 or 8. I fell off a ski lift and all that jazz. And I went out to California. I got adjusted by Dr. Drew Hall. And my body was going crazy trying to figure out how to deal with that vertebra being in the right place. And it took a few weeks for my body to take it in the process. And that was about a month and a half ago. I was totally depressed, totally just life was like not right. And I finally feel like a normal human being. My neck is finally where it's supposed to be. And it's just unbelievable to me how when you get your body working right, how different it can be. But you have to get that upper cervical right. It cannot just be. And I just got adjusted by somebody, and they pushed it the wrong way, and I didn't know that until after I saw my image of where things were. But unbelievable difference in how the body functions. And yeah, so I agree with you. So
It's so, I mean, you can do everything right, but if your brain cannot communicate to all your cells and tissues, it will not be well. And our
it will not.
state is well-being.
Yep.
Our natural
100%.
state emotionally, our natural state physically, our natural state is well-being. It's not something we have to pursue, we are. But then life happens and all of this stuff changes, but our natural state is well-being.
Yep.
And so through regular chiropractic care, then we connect that so that we can be well. So I know that you're probably late now for your practice owners. Thank you so much for joining me. This is Dr. James's first Facebook Live.
Yeah.
You guys can throw in the comment section. Way to go. He didn't know what was happening. I just said, let's go live. So you did a great job. Thank you so much. And I'll email you to get rescheduled for next week.
Okay. Thanks so much. It was fun.
Have a great day. Bye, everyone.